I will be giving you a brief update on COVID-19 treatment and vaccine updates and how our health plans are working to serve our members during this pandemic. I'm sure you are aware that nationwide, we are experiencing the dreaded fall and winter surge. The U.S. surpassed 11 million cases on Sunday, and the latest 1 million cases were added in just 7 days. The daily average of new cases is up by 80% from 2 weeks ago. For a time, it looked like California was bucking the nationwide trend, but sadly, our state is now experiencing the fastest increase in coronavirus cases since the beginning of the pandemic. Over a 7-day period beginning November 1st, the state saw a more than 50% increase in cases. And our governor announced yesterday afternoon that 94% of our state, so 41 counties, will revert back to the most restrictive purple tier effective today. The governor is also considering the possibility of instituting a statewide curfew, though his office is still reviewing the data from other states and countries that have already implemented curfews. Against this dire backdrop, there are some incredibly bright and hopeful spots around treatment and prevention that are important to highlight. Treatment of COVID has certainly improved dramatically since the early days of the pandemic. As we learn more and more about this virus, doctors and nurses just keep getting better at treating the disease. They know what works, what doesn't work. Experience has taught doctors more about whether to put people on ventilators, how much oxygen to provide, and how to prevent some of the worst effects of the disease before our immune systems have had a chance to react significantly. And most significant of all right now is the news last week from Pfizer and just yesterday from Moderna that their vaccine candidates are 90% and almost 95% effective, respectively, in preventing the disease among volunteers who had no prior infection. We have learned that these two vaccines are quite similar in efficacy because they both use the same basic vaccine design, but they do have some distinct differences. One major difference is how the vaccines need to be stored. Moderna's vaccine can be stored in a normal refrigerator for up to 30 days. By contrast, the Pfizer vaccine has to be kept at minus 70 degrees Celsius. This feature may make mass distribution of the Moderna vaccine much less challenging. Both these high-efficacy vaccines, however, will be necessary to adequately vaccinate our population. And there are some things we still need to learn about both vaccines. We don't know how long protection will last, if they will give short-term immunity like a flu vaccine or longer protection like some of the childhood vaccines. And we don't know yet if the vaccines work in certain groups better than others. While neither trial uncovered any serious side effects, we will not know the long-term safety profile of these vaccines for some time. In terms of timeline of when these vaccines will be approved and available, we don't know exactly when, but they may be available for limited distribution to healthcare workers and those at increased risk for severe disease as early as the end of the year and widely available to the public by mid-2021. We will be following COVID vaccine distribution closely, and we continue to work with the plans on all issues related to COVID. And in fact, just completed our quarterly business reviews with each of the plans, where we discussed at length their COVID response and looking to the future regarding vaccine availability and readiness. Some of the trends we noted previously with you, such as telehealth utilization and mail order uptake of medications, continue to be high, and we anticipate that these will be long-lasting impacts of COVID-19. We continue to track grievances and appeals as they relate to COVID, and I'm pleased to say that it's been very quiet on that front. And the concerns that members had earlier in the summer around testing availability do not appear to be an issue now. And I believe that that has to do with the massive effort on the part of our health plans and the state to increase and maintain testing capacity. Testing plays a major role in fighting COVID-19, and we have been keeping close tabs on the availability for our members. Finally, as we look forward to the holidays, it's never been more important for us all to take action against the pandemic. Isolate as much as possible. wear masks, avoid indoor groups, and all the stuff that we already know about, but that we're all understandably growing weary and fatigued. We're not going to be doing all this forever. I really think that the vaccine results may be the light at the end of the tunnel. Please hang on and stay safe.